Hi, everyone. Thank you so much for coming. My name's Dr. Lisa Nelson. You'll also see me as DiGregorio. That's just changed, Dr. DiGregorio. I'm in the School of Nursing, and I teach the psychiatric mental health nurse practitioners, which is just wonderful. My research was on barriers to healthcare for transgender individuals. And this, it was, of course, focused on healthcare, because I'm a nurse, but it resonates through society, our students, what we could do in society for our students, if you're a provider, as a provider. So it really does cover anybody that we touch. So, first, gender refers to an individual's deeply experienced and intrinsic sense of who they are. Transgender individuals are those whose identity of who they are is different than the identity they were assigned at birth. Cisgender are individuals who identify as the gender they were assigned at birth. Now, this should not be put together with gender identity is different than sexual orientation. I ran a group with transgender individuals who are my age and older, who lived their lives not as the identity that they were, and they raised families, and then they decided, when they became older, I can't do this anymore. And the reason I'm bringing this up is because sexual orientation came into it when they transitioned. Some marriages stayed together, and they had, a sex life, and some parted because that was something that they didn't connect with. And the woman, the trans woman, who runs the Friedman Center, which is a LGBTQ center for groups and support and for therapy, said it to me this way. She said, gender is who I am, and sexual orientation is who I want to go to bed with. So if you look at it that way, it's pretty clear. Barriers. Active erasure, passive erasure, institutional erasure. Active erasure is the violence, either verbally or actively, against an individual who's transgender. And it also happens with providers, in provider offices. Passive erasure is not knowing that they're transgender individuals and not knowing that it's important to know about transgender individuals and their issues. And institutional erasure really speaks to us in university. They are in provider textbooks. There are no mention of transgender and transgender issues. Even in medical schools, PA schools, nursing schools. So we have to really look at that. I was very, and it's not only in the provider realm. I was very happy when I published my manuscript. I guess this is how they found me. Two business professors approached me to write in their business textbook a chapter on transgender issues. So I was thrilled because this touches everybody. So we all should be addressing this in our classrooms. And this quote really hit me. All of this time I survived, I'm one of the walking dead, because we're not counted, we're not represented anywhere. One of the issues is society, we all have this automatic belief that the gender we are assigned at birth is the gender we are. So when a transgender individual comes into our life, comes into our classrooms, comes into our workplace, it challenges that belief. And that's an unconscious thing. So we may not even know what we're feeling or why we're feeling it. Barriers to healthcare range from discrimination, which I talked about before, active erasure, passive erasure, lack of provider knowledge. Many transgender individuals, when you speak with them and in the research, say that they stop themselves from going for care because they feel like they're teaching their provider. Their provider isn't aware of what their needs are and their healthcare risks. And also mental health issues. We have to be, of course, I'm a psychiatric nurse practitioner, so this is where I go. And with in psychiatry, we can't assume when somebody comes into our offices, oh, their issue is because they're transgender. They need to work on their transgenderness. It's not about that. When you look at the research, what it's about is depression, anxiety, for the way they're being treated by society, for their marginalized status, for not having protection by laws. So those are the issues they're coming in with. So when we see a transgender individual, we can't assume their issue is being transgender, because we'll miss everything they need. Transgender individuals experience discrimination through microaggressions, overt expression of disapproval. Now, I'm told that I'm very expressive. So to do this, you have to really be aware of who you are and how you present. And in psychiatry, I could tell you that we work on that because how we present in our verbal and nonverbal is very, very important. So we need to look at that, not pathologizing transgender identification. So when we look at a transgender individual, they're a transgender individual. There's nothing pathological about it. And at this point, I'll tell you, I was remiss. Transgender female is a person that was identified as birth as male, and their true identity is female, so they're a transgender female. And a transgender male is someone who is identified at birth as their gender as female, and their true identity and transition is to being a male. So we have to not pathologize that experience. Invasion of bodily privacy has happened, according to the research, where transgender individuals will go in to their primary for bronchitis. And the primary is so interested in what's happening with transgenderness that they'll say, "Can I see your top surgery?" It has nothing to do with why they're in for their illness. So invasion of bodily privacy. Difference blindness, which I talked about before. The unconscious assumption that everyone's cisgender. So when we have that approach, when somebody transgender comes into our life, it challenges that belief unconsciously. So we have some reactivity, and we have to really work on that. Self-awareness essentials. That's what it all comes down to. We have to be self-aware. To have these changes and really approach transgender individuals in the way they should be approached as human beings that are transgender, and that's their gender identity. We need to be aware of how we see the world, how we see our identity. And of course, there are many ways to be self-aware. Of course, I think everyone should go to therapy because I'm a psychiatric nurse practitioner and I say this to everyone. So that helps self-awareness, just reflecting on ourselves, meditating, which really helps our self-reflection, self-development, learning, reading, mindfulness, being in the moment with the person you're with, So there are a lot of ways. Now, when we do studies, there have been studies in the past, even healthcare studies, where transgender individuals weren't able to identify. So if you're not able to identify, how do we know what you need? So we need it's starting to change now. And when we direct our students to do research, we need to tell them that transgender individuals need to be able to identify. Also, we want to ask transgender individuals, what are the issues? What are the things you need addressed? And have enable trans individuals to participate in the research. Also being aware of transgender individuals, there are different communities they're in. So they may be in a community that has several levels of discrimination. And so their needs might be different. So it's not one size fits all when we research. And we need to put trans issues in textbooks. Like I said, I'm thrilled that it's going in a business textbook. Non-pathologizing research questions, which you really have to be mindful when you write that question, right? Because if you're not aware that it's pathologizing, you know, how are you going to fix it? So that self-awareness is key. Trans issues in curriculum, and creating a trans-sensitive environment, which I think as professors, we really need to be aware of and use the right pronouns and model that. Ask students what name they want to be addressed as, what their pronouns are, and use them. It doesn't matter if it's legally changed, use them. Society, if we change it up and have society assume that everyone is transgender and can be transgender, that might take that barrier away that we have that reaction when somebody transgender comes into our life. So we need to recognize the influence of institutional barriers on the lives of transgender individuals in the healthcare, in workplace, in our classrooms, and promote social change. So anytime you see laws or discussions that are coming up that are taking rights away from transgender individuals, we need to write our congressman. We need to, I know in the as a healthcare provider, the healthcare, like the American Nurses Association, they'll contact us and say, as a member, and say, this is what's happening, send this letter. So it might not be as easy when you're not in the healthcare field, but if you see something coming up that way, write your congressman. Let them know that this is not okay for us. So we need to increase our awareness of our own worldview and get in touch with that, and aspects of our own identity and get in touch with that. And once we're secure in all that, it's easier to be secure with the rest. Okay.